Awesome. So, good evening, everyone. It is with utmost pleasure that I welcome you to the opening night of the University of Connecticut's second annual Global Health Symposium. You may be wondering, sitting here on a Friday night, why am I here? Let me try to convince you why the cause of global health is worth your time. The world is facing one of the greatest states of health disparity that it has ever seen. A child born in Japan can expect to live 43 years longer than one born in Sierra Leone. In the United States, this disparity can be seen between zip codes. From one suburb of New Orleans to the next, life expectancy can dip 25 years. Health inequity is directly linked to social inequality. Social determinants like economic stability, education level, social context, access to health care, and housing environment have been shown to decide health outcomes. In fact, in 2011, these social factors in impoverished communities accounted for over 1/3 of the total deaths in our own country. Lower education levels directly correlate with lower income levels, which in turn decrease housing opportunity, access to healthy foods, quality school districts, and health care. This pattern can be seen just by observing your local communities in Connecticut and more broadly, the United States. A vicious cycle ensues. Social determinants drive health issues, and health issues prevent the poor from escaping their social circumstances. To address global health is to address that for many, geography is destiny. This year's symposium, Winning the Birth Lottery, Globalization in Health, seeks to explore the idea of the birth lottery. How does the location of an individual's birth impact their access to life and care? Over the course of tonight and tomorrow, we wish to equip you with a more intersectional perspective towards global health. Global health is not the health of the other. On the contrary, it is the health of us all. Global health is not just medicine, it is also a matter of human rights. It is women's sexuality and gender studies. It is political, impacted by the state, and deeply intertwined with global economies. Global health is infrastructural development, which utilizes engineers, mathematicians, architects. It can be achieved by educators, artists, writers, lawyers, activists, and social entrepreneurs. The fight for global health involves, well, a globe of engaged citizens. Everyone is needed in the fight for a healthier world. This symposium began from a humble desire to bring this global health conversation to Connecticut's flagship university campus. Although global health is the fastest growing major in the country, and student interest in the field has been increasing in parallel here at UConn, we have yet to establish a global health major program here. For years, there has been a gap on this campus for students passionate about global health to explore their interests, learn from leaders in the field, and otherwise equip themselves with the skills to think critically about global health systems and inequities. Students often find themselves leaving campus to learn more about global health. A group of passionate students and myself wished to change this narrative in 2017. Like a domino effect, what began with one student became two, which became four, and continued to multiply until we finally established the UConn Global Health Symposium Organizing Committee, now a thriving organization with committed students from all class years. UConn's inaugural Global Health Symposium took place on March 24th, 2018, just one short year ago. Titled Think Global, Act Local, we sought to set the tone of the global health conversation that our campus and state need to partake in. In an increasingly globalized world, we believe students need the skills to not only think about overarching health issues and themes that transcend borders, but also the tools to recognize these same themes in their neighborhoods and surrounding communities. We are continuing that legacy this year. In this weekend symposium, we aim to expose you to health issues in parts of the world you may not know much about, and then help you understand the common underlying socioeconomic, geopolitical, and cultural determinants that contribute to them. By the end of the symposium, we hope to inspire you to make achieving global health a part of your mission, or at least something you think about more often. You will gain the chance to think critically about problems larger than yourself, and will then be forced to wonder how we can craft creative, culturally competent solutions to these problems. Please take advantage of your peers and neighbors at this symposium. There will be multiple opportunities for you to build connections with them over the multimedia material presented to you today and tomorrow. Most importantly, we hope to equip you with the skills to make a tangible impact on the field of global health as an advocate and as a student, starting today, and to help you understand why your presence here in this room tonight is so vital to building a healthier, more connected world. The people in this room are the future, and the future of global health begins now. UConn GLOSOC proudly presents the second annual Symposium, Winning the Birth Lottery, Globalization and Health. On that note, I'm pleased to welcome Dr. Park to our campus. Dr. Key Park is a faculty member at the program in Global Surgery and Social Change at the Harvard Medical School. The mission of the program in Global Surgery and Social Change is to achieve universal access to safe, affordable, and timely surgical, obstetric, and anesthesia care by strengthening surgical systems through research, policy, development, and training leaders in academic global surgery. His areas of research interests include the science of integration of surgical care into emerging health systems, the political economy of surgical care as a global health priority, global governance and surgical care, and bridging the research with policy and implementation. He's also a pioneering researcher in the emerging field of global neurosurgery, which explores how best to deliver neurosurgical care to all who need it, whenever and wherever. His North Korea-related academic interests include studying the unique features of the North Korean public health system, how geopolitical factors influence human security and humanitarian aid on the Korean Peninsula, and the complex relationships between international security, health, and human rights. As the director of DPRK programs for the Korean American Medical Association, Dr. Park leads a group of doctors and students in an effort to broadly engage in the health sector. The goal is to improve safety, quality, and access to all who need medical and surgical care to strengthening of the healthcare system. Some ongoing activities that Dr. Park partakes in include biannual medical exchange trips to DPRK, the Democratic. Dr. Park, would you like to tell us what DPRK stands for?
Democratic People's Republic of Korea.
There we go. International medical conferences in DPRK co-organized with the DPRK Medical Association, medical student engagement programs, and support for overseas training of DPRK doctors. Without further ado, please give a warm welcome and round of applause to Dr. Key Park.
Can you all hear me?
This one is How about this? Is that better? Okay. I feel like I have to build out a song in Korean. Maybe after. First, I want to say thank you to Akshana Lucas, Akshana, for inviting me to this conference. I love speaking to students. You guys are sort of the driving force behind what's happening to global health as an academic discipline. It was because of the demands created by you, people like you, that the universities have to respond and create departments and majors in global health. So keep it going. I'm happy to support you any way I can. Another theme of this conference is winning the birth lottery. And I'd like to flip that over, at least for this talk, because we're talking about North Korea, right? It's really where being born in North Korea could be the other opposite, right, of winning. I don't want to say losing, but yeah, it's the other extreme. You didn't win, but you're in this condition where probably it's one of the most isolated countries in the world. So I'm going to be talking about geopolitical determinants of health in North Korea. As Akshana mentioned, I do go to North Korea twice a year. I've been doing that since 2007. And then lately, because of the travel ban, the State Department has to issue an approval before we can go. And I was there last May. I wasn't able to go last September because the State Department denied my travel there. But most recently, I've been given approval once again to go back. So I'll be going there at the beginning of May. So, Democratic People's Republic of Korea, North Korea, right? That's what most of us refer to. It was Korea used to be one country. Most of you know that. It was divided right after the end of World War II when Japan surrendered. So I'm going to put some dates up here and challenge you, maybe a quiz. August 6th and 9th, 1945. Anyone know the significance of these two dates?
Hiroshima.
Hiroshima, Nagasaki, right? The U.S. dropped nuclear weapons, bombs, into Hiroshima on August the 6th, and August the 9th, 3 days later, another bomb in Nagasaki. 200,000 civilians were killed. It's the only instance that a nuclear weapon was ever used in the history of mankind in war. About August 8th, 1945. Why is that date in there? It's a tough one. So just between the two bombs, the Soviet Union decided to enter and then declare war on Japan. That happened on August 8th, 1945. So they came down on the north, what is now North Korea, right? And they started attacking and coming down in the northern part. So you can, there's a border that Korea shares with Russia. August 15th, 1945. It's a famous day. Yes? Surrender of Japan. Thank you, Guy. Japan surrenders basically a week after the two bombs. They said, we don't want any more bloodshed, right? They surrender. When they surrender, the U.S. is now the victor. And they have to decide what to do with the Soviets who had just declared war. So the U.S. government asked two colonels. One colonel was Colonel Dean Rusk. He actually ended up being the Secretary of State later on. And asked them to figure out how to basically part Korean Peninsula into the Soviet section and the US section. And this is what he wrote in his memoirs. Using a National Geographic map, we looked just north of Seoul, because Seoul was the capital, for a convenient dividing line, but could not find a natural geographical line. We saw instead the 38th parallel and decided to recommend that. That was it. A colonel, US Army, just put a line across. And that's what divided North and South Korea, even today. So Korean War ensued 5 years later because ideologically North Korea was communist and South Korea was a US trustee. They put a president in there. And there was a desire by the Korean people to unify the country. And the way this happened was the North Korea decided to invade South Korea to unify the country into one. 2 million. Anybody know what that number represents?
Number of people killed or?
Yes. 2 million Korean people died during the Korean War. Just take a few seconds. I just want to take a pause to let that number sink in. About 635,000. I'll give you the unit of measure, tons, metric tons. That's the amount of bombs that were dropped in the northern part of Korea, North Korea, during the Korean War. It exceeded the total amount of ordnance that was dropped in the entire Pacific theater during World War II. They basically bombed the whole country. General Curtis LeMay, who was head of the Strategic Air Command, stated, I quote, over a period of 3 years or so, we killed off, what? 20% of population of North Korea. They had run out of strategic targets. They were now bombing civilians. I don't have time to get into all this, but there was a letter from the foreign minister of North Korea during the bombing to the UN, appealing to stop this killing of civilians. We can talk about that some other time. So it just puts into some historical context of the way the North Koreans think. So you see these propaganda posters, right? This one on the left, you can see how the North Korean soldiers are fighting and then really intimidating the Americans. On the right, the civilian, all the different forces, once again, beating the Americans. There's a lot of hostility, a lot of anger. But I will tell you, if you look behind that, there's a sheer fear. Sheer sense of overwhelming paranoia within North Korea because of what had happened during Korean War. And that's what drives their national policies, their priorities. This is, for them, a matter of survival. And they have an incredibly heightened sense of paranoia. And we're not helping. So North Koreans call this US hostile policies. So the armistice was signed in 1953. All parties were supposed to convene in Geneva within 6 months, and they did. South Korea, North Korea, US, the UN, and they discussed an open election for the entire Korean peninsula. But the talks failed because the US insisted that the UN be the observer of the elections, which on one hand sounds like a very reasonable idea, but that was a no deal for North Koreans. Why? The UN was a combatant in the Korean conflict. So for the North Koreans, they could not accept the combatant would be, in fact, on the other side, right? Would be an independent observer of the elections. Talks fell apart. The armistice was signed by heads of the military, was never signed off by heads of state. That's why there's no peace treaty. That's why we're still stuck in the armistice. One of the terms of the armistice was no introduction of new weaponry into the Korean peninsula. In 1958, in January, US brought in tactical nuclear weapons into South Korea. And we told the North Koreans we're doing that. And the weapons were stationed in South Korea until the 1990s, aimed at North Korea. A lot of people don't know that. I'm always surprised. In fact, I didn't know that for a long time either. But to have a nuclear arsenal aimed at you, that close to you, also feeds into this overwhelming sense of paranoia. And US has threatened to use nuclear weapons against North Korea over 20 times. We also conduct what we call defensive exercises. These are the South Korean-US joint military exercises. They've been on hold since Singapore summit last year. President Trump says we're going to put those on hold. The North Koreans are they consider these exercises highly provocative. And if you put it into the context, the historical context, you will understand that. When you have amphibious landing drills within miles of your border, and then they have drills that are named like decapitation drills, exercises. Yes, these are designed to clearly intimidate and scare the North Korean leadership, and it does. And the North Koreans have said over and over again, please stop these exercises. I'm glad they're on hold at the moment. There's some push by some members of Congress to resume these exercises, and I think they'll be counterproductive to current diplomatic rapprochement. B-1 bombers, you see this every once in a while, right? You know, the North Koreans would fire a missile. A few weeks later, you hear in the newspapers, oh, you know, the Americans, we flew a nuclear-capable bomber right to the border of North Korean airspace, turned it around and came back. The whole purpose is to frighten them. Once again, hostile policies feeds into their paranoia. And this is the worst, I think, and this was that seal the deal, which I think the North Koreans decided we have to have nuclear weapons or we're toast. And this is when George W. Bush, in his famous State of the Union address, said we have an axis of evil in this world, and that includes Iraq, Iran, and North Korea. And you know what happened to Iraq? We invaded Iraq. Iran and North Korea knew that they had to have something to deter invasion. North Korea succeeded by developing nuclear capability. Iran's trying to do that. While they were trying to do that, there was the agreement, which now we have abandoned. Let's just compare the military capacity with North Korea and South Korea, their closest neighbor, at war with across the DMZ. North Korea has doubled the number of soldiers. Almost over 1 million North Korean soldiers serve in the army. South Korea has half that amount. And I skip over to the right side to military spending. And this is a few years back, but I think the numbers are still good. North Korea spends $8 billion a year on its military. And South Korea outspends dollar for dollar 3 times that of North Korea. North Koreans, they can't even afford the fuel to go practice their fighter jets on a regular basis. However, if you look at the actual amount of money spent on their military as a proportion of what their annual budget, the percent of their GDP, for South Korea, it's 2.8%. It's not a huge amount. But for North Korea, it's 22%. Some people think it's as high as 33%. That's a massive amount of your national budget going to a military to defend themselves. And if you think about it, what is being diverted can't be used for their social programs, right? Social budget, education, healthcare, agriculture. It's all being sucked up into this military. It's not because they want to be this bad boy on the block. Once again, it's that incredible sense of paranoia that they have to defend their country at all costs. I just met with the health attaché in Geneva, the North Korean mission. They have a permanent mission in Geneva. And we're talking about something else, which I'll get to a little bit later. And he said to me, how many people speak Korean here? We have some Korean speakers. So I'm going to do my North Korean accent imitation. So he was saying to me, 박기봉 선생, 우리나라는 아직 전쟁 중입니다. 우리 국가 안보가 제일 중요합니다. I'll translate to you. I said, Dr. Park, we are still at war. And our number one priority is national security. That's what they believe. This is what they tell their people. They're willing to allow the government to spend so much money on their military because they believe it. This is what they buy into. So let's switch gears a little bit and talk about the North Korean healthcare system. It's 25 million people at the moment. South Korea has about double that population. The single-party socialist state. Current GDP estimates are between 25 billion to 40 billion. Exact numbers not known, but that's about the ballpark. Per capita income is 1,000 per person. So this is the data that we can draw from the World Bank. They have health metrics from all these countries. And one of the indicators of health system strength is the maternal mortality ratio. So given every 100,000 births, you look at the number of mothers that actually die during birth. If you look at North Korea's numbers, this is from 1990, and then most recently 2015. So if you look at 1992, their maternal mortality ratio was down to about 55 per 100,000 live births. It was actually quite good. Then there's this massive increase in the mid to late 1990s. And does anyone know what happened in the late 90s? I'm sure. Yeah. Absolutely. There's natural disasters, collapse of the Soviet bloc. There's a bunch of things coming together. And people thought North Korea was going to collapse at that point. People were literally preparing for opening up of North Korean state. Their health system certainly took a huge hit. Their maternal mortality ratio went up to as high as 130. Now since then, and it's important to know what happened in the 1990s. North Korea actually officially asked for international help at that point. They appealed for external help. And this is when many of the NGOs that are currently working in North Korea went in the 1990s, including some of the US NGOs. So they went in, they started helping, and as you can see, the MMR, this is one of the tracer indicators, has been going down gradually ever since then. The Sustainable Development Goals, it's a goal set by basically all the member states of the UN. Their target for 2030 for maternal mortality rate is to be below 70 for every country. North Korea is almost there already. They were there before the pandemic, and I don't think they'll have any problem reaching it. What this says is that the North Koreans know how to take care of their people, and they've done it in the past. It's the lack of resources, the money, that's preventing them from getting better results than they have now. Just as a comparison, I can tell you the maternal mortality rate for Philippines is 114 per 100,000, Morocco 121, Cambodia 162. So North Korea, compared to some of its peers, does remarkably well from the public health standpoint. So health spending, and this is disputable, and no one can really confirm it, but Gavi, the Global Alliance for Vaccination and Immunization, they do almost all the vaccinations in North Korea, and they're getting incredibly high vaccination rates, almost 98, 99%, and we believe that. They do this in co-financing with the North Korean Ministry of Public Health. So when they co-finance, it's based on their annual spending on health. So we could back calculate and figure out how much they're spending on health as a percentage of GDP. And it's about 6.5% of their GDP on health a year. That's pretty respectable. If you hear people that throw out phrases like, North Korea has abandoned its people, it's not feeding its people, it's not taking care of its people. I don't believe that. I think some people make that argument, and I'll get to it a little bit later, but if you look at the numbers, no, they still are investing in the health of their people. They just haven't taken all away. The question is, the issue is that they do just enough, but they have competing interests, right? Remember, defense. So the health spending is 6.5% of their GDP. Our data shows that over the last 10 years, as they have been increasing their nuclear missile technology and their percentage spending of health has actually gone up every year. So it's not like they've spent more on weapons and took away from the health. There's a certain amount of commitment to providing health care. And they have a massive number of doctors, nurses, healthcare workers. They're all paid a salary. And most of the money that's spent is supporting this cadre of healthcare workers. So if you look at the per person healthcare spending, it's about $41 per person per year. It used to be, some people quoted $1 per person per year. We found that to be actually inaccurate. Cambodia, they're spending about $183 per person per year. Do you remember the maternal mortality ratio for Cambodia? It's almost double that of North Korea. So North Korea is spending much less, but getting much better results. And you'll see this theme repeated in other areas. So this is me. I'm working in the operating room in North Korea. I'm actually a neurosurgeon by training. And I'm working across the table with one of my North Korean colleagues. And I like to tell this, what it feels like as a surgeon, but I'm an American surgeon. And I'm supposed to, technically, I'm from an adversarial country, right? U.S. is technically a war with North Korea. So I'm from a country that's at war with them. And my colleague is a neurosurgeon from North Korea. We stand across a patient, we bang our heads against each other, and we're no longer enemies. Our enemy is actually the disease that the patient has. And we now become teammates in fighting against the disease. And that's one of the few, I wouldn't say joys, but it's something that I experience every time I work with North Koreans, that we've now become one team. And I get asked, what is it like to work in North Korean operating room? And I always use this picture, because a picture is worth 1,000 words. Anyone can, this is a scalpel, and you can see that. Anyone can see something different about this particular scalpel? Is it easy to see? What's wrong with it? It's rusted. Why is it rusted? Yeah.
It's been reused.
Yes. Yes. So those of you that have been exposed to, emergency room, doctor's offices, ORs, we use scalpel once and we throw it away. And we do this. I used to work in Ethiopia, Cambodia. Same. We use it once, we throw it away. North Koreans, they don't throw it away. They use it until it's unusable. Paul Farmer, my boss, calls this socialization for scarcity, right? They're so used to having things so scarce, it's institutionalized. It's part of their being. It's part of their social being. And I will tell you, my parents, who experienced the Korean War firsthand, they're also socialized for scarcity, and they're not poor. My dad won't throw away his shoes from 20 years ago. He goes, I might wear it sometime. To me, I go, Dad, you have other shoes. I know, I'm not going to throw these away because they still have some life left on them. It's that mentality. And I realize now, I can't change my dad and my mom. This is how they think because they remember how hard it was during the war. And this is the same thing that we see in North Korea. And when I operate, they always give me a fresh scalpel. Okay. Then one time, the scrub nurse didn't get the note that Dr. Park's scrubbing in, and they gave me a rusty scalpel. And I'm trying to cut with it, and it doesn't cut like normally. And I can see that the surgeon across the table is looking at the nurse who actually opened this. You gave me a used scalpel with these eyes that say, you screwed up, girl. Right? Because the North Koreans are so proud. This is how they operate every day. But when an American surgeon comes, they want to make sure that they look like we have plenty. Koreans are like that. Maybe understood. And I remember looking over, goes, this is not good. There's a lot of tension here. So in North Koreans, they say, 일 없습니다. It literally means, there's no problem. So I said, hey, 일 없습니다. And everybody laughed, because I don't say those kind of things in North Korea. And then it was fine after that. But it just gives you an idea of the scarcity, right? They have more scalpel. It's not like they don't have any, right? But they're going to use it till it's completely unusable. This is true with IVs, catheters that's used for injections. They use it, they clean it in gloves. One time I opened the door of this closet by mistake, and there were like 4 ladies sitting on the ground, rinsing surgical gloves, and then drying them one by one and repowdering them and folding them back up. So this is the anesthesiologist who's responsible for keeping the patient asleep while we do the operation, the surgeons do the operation. Anyone see what's different about this anesthesiologist compared to some of the anesthesiologists in the US or other high-income countries? Yeah?
He's pumping with his hands.
Excellent. There's no mechanical ventilation, right? So in the US, the anesthesiologist intubates, hooks up the circuit, makes some settings, and he does his crossword puzzles, right? I don't know any anesthesiologists here. we joke about that, but they do a great job. They're our partners. But yeah, they don't. There's a lot. All they really do is now record their vital signs. This gentleman had to bag. So this is an oxygen, an ambu bag, fills up with oxygen, and has to pump, 20, 30 times every minute. for 4 hours, and he never complained. And there's a big tank standing on the left side of the picture. That's the oxygen tank. So this is a finite amount of oxygen that fits into this tank, and it will run out at some point, and it does. When it does, there's an alarm. They just calmly bring in a new canister, and we hook it up. I got scared the first time when they disconnected the oxygen tank from the patient that we're operating on. Saying, what about the patient? And they said, no, 30 seconds or so is fine. Okay. But this is the way it used to be. This is the way we were here in the U.S. Same thing. Before we had centralized piped in oxygen, we had the tanks as well. So during the sanctions, so I've been going there since 2007 until now. I was just there last May 2018. They kept investing in health over the years. So on the left upper hand corner, there's sort of a dark corridor. That's the renovated hallway of the Pyongyang Medical College operating rooms. Before, these doors were kind of flimsy. They went ahead and put automatic doors on all the OR rooms. These are electric doors that slide back and forth. And they completely renovated it. The middle picture is a CT scan. Some of you know that. But it's a CT scan that's been designed and built in North Korea. They couldn't get parts anymore for their existing CAT scans because of sanctions. So they went ahead and they made their own freaking CT scanner. To me, it's crazy. It's crazy. And they tell me that it only costs $20,000 to make. So the CAT scanners that we use, it's $1 million. $20,000 CAT scanners, global health, innovation, watch out. There's only one machine though, and this one only does head CTs. And I've seen the image quality, it's quite good. They also mass produce ultrasound machines in North Korea. They don't rely on imported ultrasound. They make it themselves and they distribute it to the hospitals. On the right upper hand corner, this is actually an X-ray of an artificial knee that's been designed and manufactured and implanted in patients in North Korea. So, I worked in Ethiopia, I worked in Cambodia, in both countries. I've never seen them design their own implants and then manufacture them. And then in the lower hand corner, lower bottom, is a screw. It's a titanium screw used to stabilize spines after fractures or instability. I'm a neurosurgeon, I specialize in spine surgery. So they copied, okay? They broke some copyright laws, some patent laws. I know that. But they went ahead and did it. They went ahead and cut these screws, and they're using it on their patients. And they're proud of that.
Question. How
Yeah.
do they have the access to the information and the materials?
So this one was from a donated set
Okay.
that we
No,
brought
how do they get the information?
for,
Koreans. If they how do they access the information from outside?
this is not easy.
Okay.
So they don't have free access to internet. They have a centralized library, which you can only access in person. I mean, it's totally controlled who has access to it. So, only a few privileged people are able to travel outside and then get training and then go back in. But on a regular basis, like what you all have, access to internet, PubMed and all that, no, that's completely restricted. All right, so I told you what's happened over the last 2-3 years, since 2016. Since Kim Jong-un came into power, there's been a huge increase towards in missile testing, nuclear weapons testing. And then, as you know, in November of 2017, there was a Hwasong 15, which clearly demonstrated their capability, at least in distance, to reach anywhere in continental United States. And then that's when they stopped. They said, we're done. We feel that we have achieved nuclear capability. But we, in response, and along with the international community, have now passed multiple UN sanctions, which are now sectoral sanctions. These are economic sanctions These are not the smart sanctions that we had for specific to the weapons industry. These are designed to completely cut off external funding, any kind of hard currency to getting into North Korea. This includes ban of sale of seafood, any kind of mining, so coal sales, completely stop that. Garments, clothing that the women who were working in factories that were being paid to do this, that's all been banned. And then their ability to import fuel into their country has been cut to 10% of their previous year. So is that going to cause increase in food prices? Absolutely. Is that going to cause diminish the disposable income? Absolutely. So this is, I was perfectly happy working with North Korean doctors, going back and forth, and then training them. But when I started to see what was happening with this maximum pressure strategy, with now an embargo, economic embargo, which is really war in any other terms, and people are saying these aren't designed to impact ordinary lives of North Korean people. It wasn't true. These are going to impact, and we know that. And people are saying, well, no, this is to punish the government. And they were doing lip service. Because every UN sanction starts off with, these sanctions are not intended to have impact on the humanitarian condition of the people of North Korea. But it was a lie. And the UN system had failed. And I couldn't stay silent anymore. So, one of the things that I'm taught, Paul Farmer's, this is Paul Farmer's book, Mountains Over Mountains. Some of you know, Tracy Kidder's book, and he quotes Virchow, and he says, medicine is a social science, and politics is nothing more but medicine on a larger scale. Physicians are the natural attorneys of the poor. And this is what, this quote propelled me from think of me as I'm just a doctor, to say, no, when I see injustice, I have to speak out. So that's when I moved into becoming a lot more vocal about what's happening in North Korea. So I wrote an op-ed, and New York Times published it. It drives my wife crazy because she's a writer. And she says you write one thing and it gets published in the New York Times. So anyway, this has to do with the impact of the sanctions. And no one was really talking about it. And that's probably why it got into New York Times. Because no one was willing to point the finger and saying it's our fault. And people are dying of hunger in North Korea. And this came out just after the North Korean soldier defected over the border. And they had to operate on him because he had like 10 gunshot wounds in his abdomen. And when they opened him up, he was full of worms. Right? Do you remember that story? So that was the lead that I used to introduce this op-ed. So this was in December of 2017, and I'm going to talk about the article that I wrote on 38 North with my research assistant, Eliana. And there's a favorite excuse, and I kind of say this is an excuse because it's not real, saying we should not be supporting humanitarian assistance to North Korea, because it will only prop up the evil regime, or the money will be diverted to help with the weapons program. And for a long time, I think I bought that. I was like, wow, that's a reasonable argument. Yeah, we shouldn't help them. We actually analyzed what would happen. So the UN actually every year has an urgent humanitarian appeal. UN resident coordinator inside North Korea to deal with the most urgent issues, deals with food, clean water, and basic medical care. It's for 6 million people, at least in 2018. The resident coordinator asked for $111 million right away. Do you know, anyone know how much of that was actually filled? The request of $111 million. As of end of last year, so end of 2018, $25 million was pledged and funded. Came from Russia, Switzerland, France, and Sweden. South Korea said they were going to, but they didn't have the guts to put the money down. The US was putting blocks. They're using their political power to block everybody else, saying don't help North Korea. $25 million of 111, I don't know if you guys know UN system. It's pretty much the overhead to pay for the salaries and housing for the UN staff in North Korea. Probably none of this ended up being food for the children or lactating mothers or basic medicine. This year, the UN resident coordinator made another appeal. I think it's like $113 or $130 million. I hope governments step up and say this is not part of maximum pressure strategy. We need to help when we need to help. So we wanted to refute that argument that this money, let's say all $111 million gets funded for this program. How much of it can actually go to the military? First of all, we found no evidence of a large-scale, systematic diversion of humanitarian aid. 90% of the material that's provided inside the country is procured outside the country. So there's no government-sanctioned diversion. There was some history of it in the past, but more recently none. And if some of the food is diverted, it's at the mid-level officials, and the money stays within themselves. It doesn't go to some coffer, ends up going into nuclear weapons. So we just took the worst-case scenario, and we said, maybe, what's the worst that could happen of a $111 million humanitarian program? And we said it's less than 0.4% of North Korea's military spending. It's too little. It's not enough to have any impact on North Korea's ability to continue the weapons program. Yet, that $111 million is a huge lifeline for 6 million people in North Korea. Then we had to also refute this argument that North Korea, why are we spending money that North Korea should be spending, right? Why don't they feed the 6 million people? They have money. It has to do with the country's values, the government's priorities, and what they see is how they want to allocate their money. And for North Koreans, when there are natural disasters, so there's a flood in the northern part of the country, they actually mobilized 100,000 soldiers, and they gave provisions to the citizens, like temporary housing. So when there's actual disasters, they will provide. But then, as far as their ongoing basic health needs, yes, food needs, no one's really starving to death at this point, but there are people who are malnourished and they're stunted. And North Korea feels that they're doing just enough based on their priorities. And for us to say, well, we're going to punish you, and we think you should change your policies, to me, doesn't make sense. For the same reason, we can try to convince the US government they should provide free health care to everybody, and that's just not going to happen. Or we should lower student loans, so we should have basic education for everybody. That's just not going to happen, right? So this whole idea of withholding basic humanitarian assistance to try to change North Korean attitudes, I think it's flawed. And the people that are suffering are the most vulnerable, the marginalized people of North Korea. So we made that argument. We also had a meeting, and not just me, there's a group of NGOs that work in North Korea. We are quite concerned about what's happening with the sanctions. This is the most complicated sanctions regime in history, by the way, the ones that are applied to North Korea. There are sanctions after sanctions after sanctions, and they have a sanctions committee that makes decisions on what gets exempted, what doesn't get exempted. And then they rely on a panel of experts that gives them, the sanctions committee are like UN representatives for each country. The panel of experts can tell them, well, this sanctions, these North Koreans are evading this part of the sanctions, like financial loopholes or illegal trading, that kind of stuff. There was no one within the panel of experts, I think there's like 8 or 9, that had any humanitarian background. So we called them on it. We said, your sanctions all start off with, these are not intended to have impact on humanitarian conditions, but there's no expertise in the panel of experts to even evaluate that. So we called them on it, and then we had some specific recommendations on what the sanctions committee can do. And when the most recent report from the panel of experts was released last month, they put in every one of our recommendations into their recommendations. And this is supposed to have happened before we pointed it out. There's a safeguard system within the UN that whenever you start economic sanctions, you have to do a pre-sanction humanitarian assessment and have an ongoing monitoring mechanism. Because this has happened before. In Iraq, 500,000 children died as a result of sanctions. That number has been down to just 250,000, but that's too many children. So because of that, there were these safeguards set up in the UN system, but none of those were followed. So these are we recommended expediting of exemption requests, streamlining of the process, a whitelist. Right now, a piece of metal cannot go into North Korea because it's part of excluded sanction list. And nail clippers can't go in. So we said, let's create a list of things that we know are important for humanitarian assistance and make sure those don't require exemptions. They can just go in without any conditions. So whitelisting of stuff, streamlining, and an ongoing assessment of humanitarian impact of these sanctions. They put all of that into their latest set of recommendations. So I'm going to talk a little bit about a very specific example of how politics impacts health, and it has to do with the Global Fund. Anyone know about Global Fund to fight HIV, TB, and malaria? Okay. I'll give you just a slight background. It's an organization it's really a funding organization, and it accepts money from governments as well as foundations, the private-public partnership. And they fund treatment of HIV/AIDS, TB, and malaria. Annually, their grants total $4 billion. Okay? They provide basically free HIV antiretroviral drugs, anti-TB drugs, and malaria meds and things like that in most of the developing countries. And they went into North Korea in 2010. They have 2 grants, one on malaria and one on TB. And they've actually had incredible success, and I'll get to that in a minute. There's been political pressure, as you know, to withdraw and deny humanitarian assistance. The U.S., which is the largest donor of Global Fund, $1.3 billion a year. Now, I don't have any evidence, but I think there was one newspaper article which said they have independently verified that there was a political pressure from the U.S. and Japan that forced the Global Fund to pull out of North Korea. Global Fund announces in January of last year they're going to pull out of North Korea on June 30th. Just like that. They didn't even announce it, they just updated their website. We got a hold of this new website announcement, and when I say we, it's myself and KJ Sung, who works with the Eugene Bell Foundation. They just had a big documentary called Out of Breath. If you haven't seen it, please see it. We saw this, and we knew there were 100,000 patients in North Korea currently on treatment, TB treatment every day. And the drugs, if you stop those, will be a death sentence for some of them. And when we heard that, we wrote an open letter to Lancet, and Richard Horton ran it within days and said, this is a gross malpractice of public health, and you're abandoning the people of North Korea, and there's going to be an explosion of the resistance form of TB, which costs over 100 times more to treat, and it's much more lethal. So that article came out, and then a bunch of newspaper outlets picked that up, and it's been if you just Google Global Fund North Korea, you'll see all the articles that have been written about it. And we kept pressure on the Global Fund. We were hoping they would extend their, not close it out, but give it one more year for remediation. The reason they gave was unique operating conditions in North Korea, and that could not assure the board of necessary allocation of resources, assurance of allocation of resources, and effectiveness of their grants. That's what they said. So there was a CSIS in Washington. They picked this up. They made a documentary about it. You can go to their website. They had a panel Global Fund was there, they were a little defensive about it. But we kept pressuring Global Fund and said, this is completely irresponsible. So they came back with, well, we're gonna close out this grant, but we're gonna do it responsibly by creating a buffer stock. They just bought a bunch of additional drugs and then created a stock of it. And now there's enough drugs to last throughout end of this year, okay, 2019. But some of the grants are already gone. The technical officers at WHO, UNICEF, they've all been sent back. Some of the monitoring capabilities are degraded. So this is they have to re-engage. So Global Fund, we're still working with them. One of the reasons I met with the North Korean health attaché in Geneva a couple of weeks ago was specifically on this issue. We're trying to bring together some kind of resolution where the Global Fund will re-engage. The good news is the Global Fund has changed their announcement on the website. They removed that unique operating conditions, the efficacy, and they talk about we hope to re-engage sometime in the future. It seems a little bit more, positive, which I think is good. We also did a study, myself with my research assistant Eliana, and we wanted to refute their claim that the grants from Global Fund in North Korea was not effective. So we analyzed the reduction in mortality in TB in North Korea, and we compared to some of the other countries that are considered their peers. And we saw that North Korea had one of the best reduction in their TB mortality of any other countries. So they were getting huge benefits. Then we looked at how much did actually the Global Fund actually spend in North Korea compared to other countries. In North Korea, they were doing it for half the price. They were spending $90 per patient for TB in North Korea per year, whereas their worldwide average was more like $180. So when I told this to the North Korean officials, they said, oh, we should ask for more money from Global Fund. They're really funny. But yeah, so we put this out there, just keep that sustained pressure on Global Fund, right? This is what we do. I work in an academic institution like you guys, and we do research. And research can be powerful, but if you do it in the right way, with a specific question in mind. So I don't know if I should have told you, I'm a big Twitter guy. My Twitter handle's here, @KeithHart. And Twitter's awesome for advocacy and so if we tweet something about Global Fund and say, Global Fund tweets something like, we believe in ending TB for everybody in the world, someone from our little neck of the woods will be like, what about North Korea? And they'll reply to it, and or whenever we have some tweet, we'll bring in Global Fund's handle, Peter Sand's handle, right? And so a way to just keep pressure on these guys. So anyway, Jesse Bump is a professor at School of Public Health. He wrote a really nice op-ed. AidSpan is really a watchdog organization of Global Fund. And his message in his op-ed was, an organization like Global Fund, which is really a public humanitarian organization, should always have at the top of the priority the needs of the patients that they're serving, not one or two countries that are they're big donors. It's a matter of principle, and I totally agree with him on that. And we need to hold public entities accountable to the people they serve, not special interest groups. So this is the new updated version on their website. And I'll just read you the last part. It says, hope to re-engage when the operating environment allows the access and oversight required. It's a much more positive sounding one, and we're trying to have a sort of a closed meeting prior to the next board meeting, which is in May, and hopefully we'll get something resolved. And I really hope that happens soon, because it takes 6 months to order those drugs for the TB patients in North Korea. So remember I told you the drugs are going to run out end of December. So we don't have much time. So I think I showed you this one already. Oh, let me talk to you a little bit about the travel ban. You know about the Otter Warmbier case, right? In response to the Otter Warmbier dying, the U.S. State Department issued a travel ban that prevents Americans, I'm a U.S. citizen, from traveling to North Korea unless you have specific permission. And there are three categories that have a permission for. One is press, journalists. The other one is humanitarian workers. And third is the travel of national interest, like Pompeo when he goes over there, I guess. Well, last May, I was able to go to North Korea saying the State Department considered our travel humanitarian in nature and let us go. Some of you know there was a Singapore summit. After that, Pompeo went to Pyongyang. Things didn't go very well. North Koreans basically called the Americans gangster-like. And then, it didn't go very well. Pompeo comes back in July, and the U.S. decides it's time for maximum pressure 2.0. They crank up the lever. That's the only lever they know, pressure, pressure, pressure. And they blocked all U.S. NGOs, including Korean American Medical Association, Christian Friends of Korea, the Mennonite Central Committee, World Vision, all denied. Okay, pretty much, there's some slight exceptions. I think Eugene Bell sent a couple of people. They were basically interpreting life-saving drug as the only thing they want to let in. And clean water, nutrition, those who aren't humanitarian enough. And they're not humanitarian specialists. These are government people. And we actually had to sit down with the State Department, Steve Began, representatives, other representatives from State Department, and explain to them and say, listen, if someone's sick and needs surgery, but then they can't get the nutrition they need, or they have polluted water and they get sick from it, surgery's not going to do any good. And they all work as one unit. And we had to convince the State Department, where USAID is right down the hallway. I mean, they could probably ask one of them. But we were trying to tell the State Department that are working in North Korea that you have to allow food and not just basic life-saving medications, but other medical care, food, and clean water. And I think it worked because in December, Steve Began announced that he publicly set an inch on when he landed, saying, we've been interpreting humanitarian assistance in a very narrow way, which was having significant impact on humanitarian activities, and we're going to reevaluate that. And we got the message, hey, Dr. Park, you can reapply if you want to, which we did, and we got permission to go, and then Heidi Linton is now in North Korea as we speak. So they're true to their word, so they have now expanded the humanitarian assistance part, interpretation of humanitarian assistance, and it's a little bit broader. This was a letter that Senator Markey wrote when all the US-based NGOs were being denied, and basically writing a letter to the White House and saying, what's your basis for this? Has there been a policy change? So I think he really helped a lot. And then most recently, you know about Trump's tweet, basically canceling the next set of widespread, big sanctions using one single tweet. All right, so until now, if you're like me, it feels like as a global public health practitioner, my job has been people violate some major principle, and we're basically saying, no, don't do that, that's wrong. So we've been reactive. We've been sort of, pushing back on people when they violate these principles. And that's okay, we need to do that. But what if we can use health, global health, as a way to influence geopolitics? Is that something more proactive, right? Can we do that? I'm not sure, but we're actually working on that. So there was a project in the last, from 2005 to about 2014, a WHO project funded by South Korea, by the way, $65 million project to improve maternal and child health in North Korea. It's the single largest health project in North Korea today. That's over now. They were able to upgrade 50 or 60 county hospitals and do a bunch of training. We're looking at proposing there's a massive injury burden in North Korea. So if you look at this, this graph here, this is by age group, 0 to 4, 5 to 14. Okay, good. The red bars are deaths from injury. If you look at the yellow bars, under 5, most of the deaths are from what? Diarrhea, pneumonia, infectious diseases. And this is fairly common. But once you get beyond age of 5, the number one killer is injuries. So we're going to use this, and then North Korea has actually prioritized emergency care and surgical care as a strategic item in their medium-term strategic health plan. It's in there. So the question is, and we think this project to strengthen emergency and essential surgical care for injuries in North Korea will cost somewhere in the ballpark of $500 million. It's about an order of magnitude more than the previous project. And probably no one is really thinking about this because it's probably, no one's really thinking it's feasible. But you know what I say? If you don't try, the probability is 0. Right? If you try, maybe a little bit more. So I'm partnering with a colleague. He's a political scientist. Ramon Pacheco Pardo is from the Free University of Brussels. And he and I were able to get a small grant. And we're actually preparing a report looking at the injury capacity currently. What would happen and what if the injury, the North Korea country will open up like Myanmar did? What would happen to the tourism industry, road traffic, infrastructure, and what would the implications on the injury burden, which is already huge right now, what would be expected to happen? And we also did a macroeconomic analysis. What we're trying to do is create a urgent need within the global community and within DP of Korea, but they've already bought into this thing. So we try to create a political environment that will be conducive to a project like this. So South Korea, you all know that they really want to do something. They pledged $9 million in 2017 for UNICEF and World Food Program. To this date, that money hasn't been released. Anybody guess why that's not the case? Can you guess why that money's not being released? USA. We're blocking it. We're saying don't transfer that money. And South Korea to this date is unable to, as much as they want to. This is for humanitarian assistance. This is not for anything else. Unable to politically push back and say, no, we're going to do that. So Ramon is a political scientist. I'm a surgeon. But we're putting our heads together and saying, can we figure out a way to open up some windows where it's politically more attractive for South Korea, who has the money. They have $1 billion budgeted every year to help North Korea by constitution, but unable to spend because of the current political environment. So what is the political economy? What needs to happen to make that a possibility? So I will only say that just stay tuned. We'll see what happens. But we have some ideas. And we really want to challenge the international community to go ahead with a massive project like this. And we think it's possible. And I think it's a moral imperative, actually. And also to fulfill the UN urgent humanitarian request for their needs. So this is sort of, this is the end of my talk. I hope I've been able to inspire you, some of you, on what a practice of global health could look like. I hope you can find something that's important to you, that you could become passionate about, and you apply all the skills to achieve the things that you think ought to happen. Thank you very much.
Well, thank you so much for that wonderful talk, Dr. Park. Don't worry, come some do that. So now we're going Q&A mediated by our very own Professor Nai Kim from the Asian American Studies Institute, as well as UConn's Department of History. Professor Kim is one of our university's North Korean experts, and so we thought it would be fruitful and useful to the audience to have an expert in the field ask questions that we could learn from, and then the floor will be open for questions from our audience. So I think one of these tapped out, so I'm sorry, you might have to pass the mic to each other.
So, I think this is the one that's out though. I think they're both out.
They're both out.
Okay. So I tend to be soft-spoken, so if I start to lose my voice, please give me some sign. So thank you so much for such an eye-opening talk. I learned a lot, and I think all of the audience learned a lot. I would be asking some questions to begin with, and we will open the floor for more questions. And I was thinking that we would probably get a lot of direct responses to your talk. So I was thinking of starting by asking some more broader questions to get at more other perspectives about North Korean health system. So I guess what I wanted to know more, and what I was hoping that you would speak is North Korea and a lot of communist countries actually pride themselves by having a different principle regarding the healthcare, right? So it is a country, as long as its principle goes, right, that seeks to provide free national healthcare with some sort of equality. And we know that in reality it doesn't work out that way, but at least in principle, that is what they try to do, and that is what they try to apply themselves in, right? So I was hoping if you can talk a little bit about how does that principle and belief and ideology, whatever you would call it, how does that actually change? How does that actually differ from the way we in the U.S. or other democratic countries think of healthcare, and how does that principle, if not in real life, at least shape the way in which people that you have interacted with, so for instance doctors, or the way in which their planning of healthcare system pans out differently from the way we used to think of it?
Great question. So the question is, the universal health coverage that they have in Constitution of North Korea, how does it really work from an operational standpoint? The experience of the individual citizens?
I guess yes and no, because I think we all know, because of like from 1990s, whatever they had in terms of like that system is not really working, right? So a lot of people are actually looking for secondary and private care, so that is evident. But how does that different principle, the understanding of healthcare as something that should be given freely and equally to all citizens, which isn't the way in which our idea of healthcare system works, right? There are some sort of basic level of insurance, but a large portion of it has been privatized, so we actually buy access to healthcare in our capitalist system, right? So how does that difference in principle actually shape how some of the North Korean people think about healthcare in their everyday life, and how does that actually change the way in which they view human or the right to health or the right to live life?
Yeah, I think, so you're right. The way they think of healthcare is different than what we think of healthcare. For us, a lot of the healthcare is convenience, right? It's not just like absolutely essential healthcare. Bariatric surgery, I mean, that would not be heard of in North Korea. Some of the operations we do for degenerative spine conditions, North Koreans, this would be a luxury. So I'm a neurosurgeon. 70% of my operations used to be disc herniations. Now we know disc herniations after 2 years, the results after surgery or without surgery after 2 years are identical. You just get out of pain quicker. So it's really a luxury. So those kind of things are not really done in a resource limited setting. So people access healthcare only when they're desperately needed. So they don't typically just hang out in the hospital. So that's one difference. There's a mindset that the government will provide their health care when they need it, but they also know the realities. They know that, so if they have to have chemotherapy, for instance, typically they have to go to China and buy the chemotherapeutic agents, bring it back, and the doctors in North Korea will actually administer it. So this is, it's a public system with very severe limitations on the actual consumables in the commodities. And then the patients typically have to get that. But I think for the most part, the doctors are highly respected in North Korea. Now, I will tell you the other side of the coin. North Korea is still a very poor country. It's not rich by any stretch. So you look at any poor, and as I worked in Cambodia for 3 years, I lived there, and I actually worked in Ethiopia for 6 years, back and forth. And I got to see how the system works. And doctors just don't make enough money, right? There's Cambodia, the salary for a government doctor, $200 a month. And that's not a living wage, we know that. So they have to supplement their income. And they'll find different ways to do that. I think in North Korea, something similar does happen. It's just the human nature. Is it corruption? I don't know, right? But there are certain payments that are made, I'm sure, that allow someone to kind of come to the front of the line. Those kind of things happen. And I never saw it, but I'm pretty sure it happened.
So it's interesting that Americans tend to imagine North Korea as an isolated country, right? And it is largely, but there is actually a socialist sphere of influence, which actually has their own network of different support system and exchanges of experts. Healthcare technology is one of them, as we know, for instance, Cuban doctors who are doing a lot more week and so on and so forth. So what do you think is the role of, say, the Cold War in actually stopping or developing the healthcare system in North Korea? Because when there were more communist countries, right, there has been more aid or exchanges that North Korea was getting, like for instance, guaranteed from at least some from China and Soviet Union, but also like other African countries like Cuba, Vietnam, all these countries that we don't necessarily think of in terms of having a network of global exchange, right? But North Korea was actually in part of that, right? So what is, do you think, the impact of the Cold War in actually breaking down some of those networks of exchange in terms of healthcare?
So when after the Korean War, we actually published this, the history of neurosurgery in North Korea. And I co-wrote it with Professor Rowe from Shenyang Medical College. It's interesting in that Romania brought neurosurgical skills into North Korea.
Oh, cool.
Yeah. So Romanians were the sort of the twinning, right, with North Korea. And so I'll give you some interesting anecdote. The father of neurosurgery in Romania is a guy named Bagdazar, and he trained in the U.S. In Boston actually. Went back to Romania, and then he trained this guy named Arseny, who was his prodigy. And then Arseny trained the North Koreans.
Oh, wow.
So the North Koreans are actually with the same, the lineage of trainees from Harvey Cushing, who's trained almost every neurosurgeon here in the U.S. And so we're brethren in that regard.
So I guess one of the reasons that I was bringing up this question of different network of exchange that Americans don't necessarily think is that I think North Korea is also aware that they cannot live in isolation. And they're also aware that they're not necessarily seeking to be isolated, but as your talk has so brilliantly captured, the world is actually imposing, and the USA is actually imposing a lot of embargoes so that North Korea will be isolated. So what are some of the changes that you see is happening in Kim Jong-un's administration that is actually, compared to the earlier ones, more actively seeking out ways to form some sort of relationship with the world, and how does that actually impact growth of health system?
So we know that a handful of doctors in North Korea travel overseas. So there are some training opportunities through WHO, one of the women and maternal child and health program had a budget for bringing North Korean doctors outside for training. But they have also government programs. The Germans have an exchange program. The Chinese have a very active exchange program. Until recently, the British had one, the Chevening Scholarship, but I think that stopped. But so there are these different channels where North Korean doctors are able to travel overseas, and you see them a lot. And I think that brings in new information, and then they come back and teach their peers. So there's that network. There's also a sort of a Cuba model where North Koreans provide physicians to countries with critical physician shortages. I was working in Ethiopia, and then one day I ran across a neurosurgeon from North Korea working at the same hospital. I was like, oh, hi. And he ended up becoming a good friend of mine.
That's a great story.
Yeah, and he was actually a superb neurosurgeon, but he was recruited by a private hospital in Ethiopia through the North Korean embassy in Ethiopia. They've had a good relationship for a long time. So yeah, and he gets to come to Ethiopia and work, and then so I thought it was a good arrangement.
Yeah, I mean, I want to ask so much more questions, but I actually want to open the floor before I take over all the time. So, do people have any questions? Let's start from here.
So I just want to say a quick comment before I ask you my question. So first I want to just thank you kind of opening my and our eyes about some of the some of the context for why North Korea is the way it is, because I think it's so easy to just think of it as evil and a nuclear threat without ever looking into it further. But I didn't even realize that a lot of those behaviors were just a result of pressures that we applied to them and things that we in other countries have done to them. So thank you for that. And also, I wanted to ask you about preventative healthcare in North Korea, because that's kind of something that I think the U.S. doesn't do enough, and we're trying to get more into as we look towards the future. So how would you say that they do that there?
So from a public health standpoint, healthcare, curative service is probably the most expensive, right? Preventive care is the most effective, cost-effective, right? So North Korea spends a lot. They have limited resources, and they'll put it towards prevention. So I don't know if you saw the diagram earlier with the infectious diseases for the young, under 5, but injuries for the 5 to 29. But then after that, this green section is called non-communicable diseases. These are heart disease, hypertension, cancers, strokes, those kinds of things. And these are all, that has a lot to do with your lifestyle in some ways, your lifestyle choices. So there's the Framework Convention for Tobacco Control. It's probably the single most largest achievement of the World Health Organization, because it locked governments into actually passing laws about tobacco control. So you're seeing some of that in the U.S., no indoor, no smoking, that kind of stuff. North Korea signed on to this convention, and they're implementing it. And sometimes I smoke. So I went to North Korea, and they had cigarettes with the warnings. The warnings, the graphic warnings and all that. They're complying with it. It's just like they're supposed to. So that's things. So they want a healthier. They're paying for all the health care for the entire public, right? There's really no private system, with the exception of, I think, some plastic surgery business that I've heard of. I didn't see it, but there's no private clinics in North Korea, so they have to rely on public system, which means government's paying for all of it. So they really want a healthy population, as healthy as possible.
I have 2 questions, if that's okay. My first question is, as she was pointing out, I feel like on social media and in the news, North Korea is depicted as some violent country that we shouldn't be providing any aid to. But after seeing this, it's definitely opened my eyes on how humanitarian aid can help them. I'm just wondering, as students, how can we help the discussion, or open up the discussion, or bring light to this to other people on campus, and kind of be advocates for North Korea?
You're doing it right now. I mean, just, yeah, like having speakers like me come by and then talk about these issues. I mean, and it's also, I don't wanna minimize the human rights abuses in North Korea, and that's not what we talked about today, but that's also a big issue, right? The way they treat their political and prisoners. But yeah, by having these events, and you know, keep having them, and then if you have specific interest in actually doing some additional studies or research in it, and feel free to contact me. I can get you in touch with some people that could be with me, and you know, we can do research projects together. There's so much things that we could be doing. I just have, you know, I have limited bandwidth, but depending on your skill sets and interest, be happy to plug you in some projects as well.
And then my second question was about your injury graph, or injuries by death. Do you know why between those ages the injuries by death is much greater than the other kinds of diseases by death? Like, is it because more people are getting injured, or is it because just the technologies to fix injuries are just not as great, and that's when you more commonly see injuries?
So you probably, under 5, infectious disease is the #1 cause, but I think your immune system matures at some point where you're able to fight off most of the infections, right? So that infectious diseases goes down. It doesn't go to 0, but it goes down significantly. And you're much more ambulatory, and you start doing more activities. If you look at the mechanism, it's the road traffic accidents and falls. So then you start doing construction, let's say. That's a huge construction boom in North Korea right now, but buildings collapse all the time. So I don't think that particular segment is not a huge number from an absolute standpoint, but I think people are getting injured in working. And then, of course, after 29, it goes down because other things start to come into play. But that'd be an interesting thing to look at, you know, why is it, you know, is the #1 killer in that age group? But it's not, unlike some of the other countries in the developing world, that segment is huge. Cambodia, it was young males who were dying of injuries because they ride motorcycles without helmets. And it's one of the largest killers of that segment.
Maybe that question in the middle.
So, thank you for coming. I want to focus a little bit on the fact that you talked about how sanctions have crippled North Korea's access to resources, and ultimately that's a detriment to the public health. But to kind of lift those sanctions, that has to go through the UN Security Council. And how hopeful are you that eventually the sanctions will get lifted, considering all the political factors and all that at the UN Security Council, especially with the US and China both holding veto power there?
Great question. I think when the North Koreans were firing the missiles like almost every other month, it seemed like, you know, with a little sprinkling of thermonuclear power, you know, this display, the entire Security Council was on board. It was a unanimous thing, right? All 5, P5, all agreed, including China, saying, yes, we need to pass these sanctions. Now, that was, the last time they tested was in November of 2017, well, we're over 450 days since the last any testing. US and Japan are, well, Japan's not in the Security Council now, but US is completely isolated right now. All the other members of Security Councils, including Russia and China, saying, why are these sanctions in place? Weren't they designed to stop them from testing, developing equipment? They stopped testing. It's time to now start rolling back on some of these sanctions. So, but once again, as you know, the Security Council is by consensus and also with the veto power. So if the US says, you know, I'm not backing off, then it doesn't come off. But they're totally isolated right now. I think China and Russia, they have spoken out publicly and said, well, why are we doing this? And so I think slowly what you're seeing is the flouting, at least sort of in a very subtle way, like these ship-to-ship transfers, and yeah, they're providing some oil and all that. We know that's happening because the oil prices have stayed stable. So I think the Chinese, you know, they're saying, yeah, we signed on to the sanctions, but I think their enforcement in some ways may be loosening. And that's because they can't justify it anymore.
Let's get a question from.
So I also had 2 questions, and they're more about you. So how did you first get involved in public health since you trained as a neurosurgeon? And also, when you go to North Korea, we hear about these handful of cases where people are detained, and do you ever have any fears for your own personal safety?
Okay, so I'll answer the first question. I was in private practice. I didn't have global health aspirations at your age. I just wanted like a sports car. I went into private practice in Missouri, south of St. Louis, and I got my sports car. But I wasn't happy. You know, a car's a car, right? After a while, you know, how fast can you go? I was just like, I did private practice for about 10 years. It was really nice, but I was left completely unsatisfied. And then I'm a Christian, and one day I heard in church, you know, Luke, a verse from Luke, to those much has been given, much is expected. And for some reason, I had heard it before, but that moment when I heard it, I was like, I've been given so much, maybe there's something more that I could be doing than just practicing community neurosurgery. So I started looking at overseas volunteering opportunities. First, I was with these short-term medical missions, and then I quickly moved on to being a teacher in residencies. Like Ethiopia, there were 3 neurosurgeons for 90 million people. They were all in Addis Ababa. I was one of the trainees. I really liked it. Now my students are teachers. In Ethiopia, they have 45 residents. And then in Cambodia, same thing. They had started a residency program. And then while I was in Cambodia, I started to realize I can train 1,000 neurosurgeons. But unless the government, the people who are supposed to take care of their people, you know, the people who are entrusted to take care of their people, doesn't make the health of their people a priority and invest in the health system, the training of doctors, nurses, building of hospitals and all that stuff, that this is not going to change. And then I realized it was the system that needed to change. And surgery, the training of surgeons was just one tiny sliver of it. And I said, okay, I want to get involved with public health. So I did a fellowship in global surgery, and then I got a master's in public health, which I'll get in May. I'm done. And then I stayed on as faculty after my fellowship. So that's my journey in public health. I miss surgery. I'm probably going to go back doing some surgery, because that's what attracted me to the field. And then your second question was in North Korea, detainment. So the doctors, our group, we have a good relationship with the North Koreans. We've had 2 doctors who actually wandered off on their own and were captured by the police and brought back to me, because I'm the delegation chair. I got yelled at, okay? But that was it. You know, it's like, hey, don't do that. You know, it depends on the timing, but so far we've been, I guess, lucky. So I tell whoever goes with us, he says, just do whatever the guys tell you. It's really to protect us. And so, but we always get someone who pushes the envelope, you know, here and there. And so far we've not had any issues with, you know, the worst was, like I said, they were literally, you know, arrested by the police, but brought back to the hotel, and, you know, they're excluded from our future trips. But yeah, we've been okay with that. We haven't really been worried about, you know, but we should be. And we're giving good advice too. The UN mission for North Korea, that's who we process our visas with. And the gentleman who deals with our cases, the counselor, you know, the advice he gave us was, don't even leave your personal Bibles. If you're a Christian, don't leave your Bibles in your hotel room and check out, because that could be a grounds of, you know, proselytizing is illegal in North Korea. They can arrest you for that. So you know, we have people looking out for us, and so we've been okay. But we are completely aware that we're in a, you know, once we're there, yeah, they can arrest us for anything if they wanted to. But so far they've given us a little bit of wiggle room.
I think we have time for one more question, so maybe,
Have you ever faced any flashbacks here back at home in the U.S.?
Here?
Like on social media, the government, your service? Or?
Yeah, you haven't seen my Twitter?
Check it out later.
So there's an interesting phenomenon. It's the human rights group. they see me as a North Korean apologist, which I'm not, right? I'm there to advocate for continued humanitarian assistance. In order to do that, we have to engage. There's no other way to get into North Korea. So we've had some, like, people who basically, like, you know, in Korean they say, "baegeng." You know, what is communist?
Kami?
Yeah, kami, yeah, it's
Yeah.
kind of a derogatory term. So yeah, there's some social, and then, here's what happened. I said, well, if you're gonna call me names, you should at least identify yourself, because on my Twitter, I mean, I'm verified, right? Then people know who I am. This was like something. So I said, you don't have the guts to say who you are. And they said, well, I'm a defector. So, and then like 10 people chimed in who are like North Korea human rights experts, and goes, defectors, you should not expect them to be, you know, say who they are because they have to protect their identities. So I'm like, okay, so they won't, if they are defectors in fact, and they're, you know, criticizing me, they're not gonna say who they are. It was kind of, I couldn't win on this one, so I blocked that person. Well, yeah, I was worried about the South Korean regime, the administration, the last two presidents. So in 2007, when I went, Roh Moo-hyun was president. He was a progressive president. We had 30 South Korean doctors come to North Korea at the same time. After 2008, no South Korean doctors are coming into North Korea. And I was concerned for me, and I get contacted through, so if a South Korean embassy or consulate calls you in the US, that's not a good sign. If they call you out of the blue and says, can we meet? Almost always it's the intelligence service from South Korea. And so I say, no, I don't think I want to meet with you. And same thing with the US. I've been visited by the US intelligence community. I'm like, you know what, I'm just going there to do doctor work. And that's it. You know? It's fun. Life gets interesting.
With that last comment, I think we can wrap up. And I think it's a really enlightening last point, because you were talking a little bit about, you know, how such a global issue can impact individual lives, and actually an individual like you can impact and should impact global issues. So thank you so much for sharing your talk and experiences. If the audience can join me in giving a little claps to